Morning, everyone. Welcome back to another episode of the Wilderness Fitness Podcast. I am your host this morning, Dr. Rob Minturn, a physical therapist, strength and conditioning specialist. Coming to you live from New Brighton, Minnesota. I am stuck waiting for my truck in the shop. So you guys are going to get a story that you didn't ask for, but you're going to get anyway. I'm supposed to be on my way to Alaska, but I am stuck in Minnesota waiting for the truck at the shop. Just got service last week and something came loose on my way over on interstate speed. So hopefully the shop gets it fixed up today and I can get it back on the road up to Alaska. Today I am looking to share my how I got into pelvic health. There's 3 different aspects to it over the last many years that led to me getting into pelvic health, ultimately by accident. But I just wanted to share that because I don't think I've really have mentioned all 3 reasons. So that being said, let's just dive right on in. The first reason was mostly patient-based. There was, in 2021, I was working at a clinic out in Susanville, California. I had 2 or 3 women on my caseload that I wasn't exactly able to help. I was throwing the kitchen sink at them with interventions for low back pain and hip pain. That's what they were coming in for, and doing everything that I could, and nothing was changing it. So found out that there was a pelvic PT down in Reno, and I ended up sending one of my patients down to her, and in 2 sessions she was getting better. She saw improvements after a month to 5 or 6 weeks of no improvements with me with her chronic low back pain. So that opened up my eyes a little bit, and then I had a couple other patients 2 other women that I wasn't able to help. We had another PT in the clinic that was semi-versed in pelvic health, so got my patients onto her caseload, and they ended up seeing a little bit of progress then. So it's like, I should probably patch this gap in my rehab ability and take a course. Later that year, so that was in early 2021. Later that year, or I guess a few months earlier, it started in 2020, my own story. So I've had pelvic floor PT myself. I was upper 20s at the time, and I was home on Christmas break. It was end of 2020. I was home on Christmas break for a week, and I started to have left testicular pain. And I really didn't think much of it because my brother's dog had stepped on me a few times. She was a puppy, so she had stepped on me a few times, so I just thought it was a lingering bruise or something like that from being stepped on. It continued to happen, and it got more severe with exercise. What really started to scare me was pain with ejaculation. That was when it really started to be like, oh, okay, I need to go get this checked out, because men in our upper 20s and low 30s, it's a very common age to start to become diagnosed with testicular cancer. So I wanted to make sure that was not going on. So I ended up going into the urgent care one day up in Susanville, and had to go get an ultrasound. That was quite the experience. So I got an ultrasound on my left testicle, and was diagnosed with a varicocele. And I really didn't know much about, again, the male pelvic health side of things. I didn't know anything really about the female pelvic health side of things, but I wanted to take a course, and now I'm in my own setting my own story as far as like a male pelvic health situation goes. And so once I got the ultrasound, I was diagnosed, and I wanted to make sure it wasn't coming from my back, because I was dealing with some low back pain at the time, left-sided low back pain. It was my left testicle. So I went down to a pelvic floor therapist. It was actually the therapist that my patient had gone down to in Reno, and she did both male and female pelvic floor assessments. So I'm shitting bricks. I didn't know what to expect. I really didn't know what I was walking into. Again, as like I work in healthcare, but I did not know what was going to happen. I figured there was going to be an internal exam, and that was very intimidating to me. And again, I work in healthcare. So went down there. She was super cool, did the internal exam, and ended up reassuring that it was not coming from my back or my pelvic floor. I was not getting left testicular pain from any sort of radiating symptoms or referring symptoms. It was truly coming from the varicocele that I was dealing with. So I ended up having the surgery in the middle of May, and it was not exactly a great time. My contract was coming to an end at that point in Susanville, and I had to move. And with the surgery, you have a 2-week, or at least I did, I'm sure each surgeon is different, but I had a 2-week no lifting over 10-pound restriction. And as a travel therapist having to move, there's stuff that you own, that I own, that's more than 10 pounds. So my girlfriend at the time was a godsend, and she actually brought me down to surgery, and she helped me move from Susanville down to her place in California. And then after that, I was able to, the lifting restriction was lifted, and I was able to lift all my stuff to when I moved into my new spot in Oregon, when I worked in Grants Pass, Oregon. But I say that because the timing of the surgery, the timing of the treatment was not good, but I was sick of dealing with the painful symptoms that I was dealing with. I was having to take time in my work day and get my legs up on a table or on a chair, so that way the blood flow was basically treating the inflammation. And I was trying to get the blood flow out of my hips and out of my pelvis, so that way it would alleviate some of the symptoms. I wasn't able to exercise. So I just wanted to get rid of those symptoms, but again, the timing was absolutely horrible. And in the midst of all that, I ended up getting Rogue. You guys that have been following along for a while, you know who Rogue is. And I ended up getting her. She was a 7-month-old pup, and just a lot of different factors going into the fact that I probably should not have had surgery, but I ended up having surgery anyway because I knew there was not exactly going to be a great time further down the road. So fast forward to, that was in 2021, so 4 years later, 4 years later. Things are good. I still have a little bit of left testicular pain every once in a while, but it's not nearly what it was. So I would chalk it up as a successful surgery. And I'm glad I did it at the time, because again, you look back and it's like when there's no other time to really do it. So if you're dealing with something, not like your future down the road, you is not going to make a better time. You just get it done and move on with life. And then the third reason that I really wanted to get into the pelvic health side of things, and this is more towards the male side of things, is my dad was diagnosed with prostate cancer in 2019. It was a late diagnosis. His PSA levels were elevated, but they weren't elevated to the point where they were concerned. And so I'm not sure if he pushed to get a biopsy or if the nurse out in California pushed to get the biopsy done because of the elevated PSA level for the period of time that it had been elevated. But got the biopsy and ended up being diagnosed with prostate cancer. They originally diagnosed as stage 4 prostate cancer. It's not exactly a great prognosis. And he ended up having surgery on his 65th birthday, so I jokingly said, "Welcome to Medicare." And after the surgery, it was downgraded to stage 2. From that, he has continued to get his PSA levels checked every 3 months. He was on testosterone reducing medication, and because that's what the PSA, or that's what the prostate cancer feeds off of, is testosterone. So he ended up having to have radiation I want to say it was a couple years later. And after the radiation, I think a year after the radiation, he started to have pain with urination, and was struggling with incontinence. With that, there necessarily hasn't been a ton of talk, to my knowledge, as far as weight management goes and exercise prescription. I believe he's had pelvic floor therapy for incontinence, but they do 4 weeks or 6 weeks, and then they just call it good. So it's been very frustrating from my end to see the lack of follow through with weight management and with exercise prescription, not just with pelvic floor, but also with helping with weight management, because both would be extremely beneficial for him. Little side note, obesity is the number 1 risk factor for incontinence, male or female. So you don't have to have kids, you don't have to have any sort of surgery or prostate removal or anything like that. But if you are overweight, that does put you at risk for having incontinence as well. And the reason why so after prostate removal, prostatectomy, men really struggle with incontinence. This is a very, very common thing. It's generally because the prostate is very involved with urine control, and the male's pelvic floor is generally thinner than a female's pelvic floor. You guys with the childbearing and all that, your guys' pelvic floor does tend to hypertrophy a little bit more than a male's, because we don't have that, in general don't have that extra weight placed on our pelvic floor. So our pelvic floor is a bit thinner, so when something happens, we are generally more susceptible to having incontinence and struggling with bladder and bowel control. So a little side note with that. But those are the three real big reasons as to why I got into pelvic health. One was because I wasn't able to help patients, so I wanted to patch that gap in my rehab. I have had my own pelvic floor exam and pelvic story as far as the varicocelectomy, and then my dad struggling with the prostate cancer that led me down the male pelvic health. So that's stuff I'm still learning about. So in conclusion, it was basically an accident that I got into pelvic health. It wasn't something that I intended to really focus on, but while I was taking the course, I was able to help 3 women in the clinic. When I was taking the course, I was week 3, and I started to ask questions and started to make treatment modifications, and ended up helping 3 women while I was still taking the 8-week course. And so that led to me posting a few things on Instagram, which led to me helping some women online. So that's where the Wilderness Fitness Institute has started to go down the pelvic floor side of things. And I share my story because of the fact that just due to a few Instagram posts, I've had some old friends reach out with some of their own male pelvic floor stories and asking questions. So I wanted to make it known that you're not alone. It's not uncommon for men to struggle with pelvic floor issues and pelvic issues in general. So just to feel that you're not alone and there is a resource out there. There are things that you can do. And I wanted to share my dad's story to normalize screening. If you're a male and you have a brother or a father that has been diagnosed with prostate cancer, the youngest age that you should, or the oldest age that you should be getting screened is at 45. If you've had both your father and a brother get diagnosed with prostate cancer, you should be getting screened at 40. If you don't really know, like if you grew up without really knowing your dad, it's best you can start screening at 40. There's nothing, you're not going to do anything wrong by getting screened earlier. In fact, you might catch something a little bit sooner than later. So there's nothing wrong with getting screened earlier and setting a normal as to what it should be like, and then going from there with having a normal established. So anyway, I'll stop chatting. I need to call the mechanic, and hopefully you guys have an awesome Tuesday and are enjoying this lovely, rainy, windy weather, and we'll catch you later this week once I get up to Alaska. Peace.